All right, if you're separating the health of your smile from your overall health profile, you're falling for one of the biggest myths around. Many folks don't equate oral health with their oral health profile. Dr. Charles Martin joins us this morning to talk about some myths. Myth. Yes,
That's right.
over
That's
here.
right.
All right, let's talk about this. If your teeth are in bad condition, it's got to affect your health, doesn't it?
It does.
Yeah.
It's a negative spiral downward. It infects you related to your heart disease, increases your risk for stroke, upper respiratory infections, worsens diabetic condition dramatically. It affects you in every way feasible. Even pregnant mothers, they'll tend to have low birth weight babies because of their dental conditions. So not having healthy teeth sets you up for other problems. And the second thing is that it sets you up for a reduced lifespan. We're having empiric evidence that suggests that as much as 6 to 10 years of less life.
Was this generations ago when we didn't have the kind of dental health that we do nowadays, that the life expectancy was so much shorter then? Is that a big factor?
Well, I think it's a factor. Lots of other things. What we know about nutrition and medical care, which we're so much better than we used to be. But of course, it wasn't that long ago. The average lifespan was 47 years of age.
All right, we've got better teeth, we live longer. So
That's absolutely true.
Let's talk about our parents and their teeth. When I was a little boy, it wasn't unusual to see a lot of people had partials and false teeth.
Right.
You don't see that much anymore.
Right. Well, what the myth is that a person will say, well, my parents had bad teeth, I will too. Genetics is a factor, but how big a factor is it? This big.
Not much, huh?
It's a little one. Whereas our behavior, our home care, how we visit the dentist is this big. So, but people think it's this big. So it's not. So you're not condemned to a bad condition if your parents had one. You can do something about it.
Okay. Well, let's do something about it. I don't even know how to start with this question. Somebody asks, do you lose a tooth for every child that is born? I don't even know where you go with that.
This is a myth that I'm not sure where it began, but there is no evidence whatsoever in any shape, form, or manner that because you're pregnant, you're going to lose a tooth. And for every pregnancy, you lose another tooth. It isn't the way it works.
Wow.
Just isn't.
That just seems to me on the face of it. It's like, oh, that seems ridiculous.
It doesn't work that way.
Okay. Does denture work? Is it just as good as natural teeth or dental implants?
No. No, not by any stretch. Yeah. The functional capacity of a denture wearer is about 15/100ths of natural teeth or having dental implants too.
Not near as good.
Not nearly as good. And plus the pain associated with these flopsy-mopsy
stuff,
and what they are, the oral wigs.
All right. I think we have a slide we're going to put up here, and there we go.
Yeah.
Tell us about this a little bit.
Well, this lady was not real happy with the way her teeth looked, so she wanted something done, and so we did a smile makeover. And you can see how much difference it makes in how she looks. And, people see eyes and teeth as one of the first things they see.
Real quick, in about 10 seconds, if my teeth don't hurt and my gums don't bleed, is everything okay?
No.
No. That's
the quickie. No, they're not.
Answer, we got one. No,
just like if you tell your blood pressure without measuring it, you need to have an examination.
All right, thank you, doctor.